Hi, today we are going to talk about foot health in babies and children under 5 years old, regarding their foot development, red flags for flat feet, diagnosis and possible treatments, and some suggestions about choosing shoes at the end.
Firstly, it is important to analyze the gestational age of a developing baby during a pregnancy. The gestational age is referred to the duration of pregnancy in completed weeks. Knowing the gestational age is essential because it provides a baseline for assessing whether an infant's growth, development, and musculoskeletal structures are appropriate for their stage of maturity, especially those relevant to podiatry. It is reported in three categories: preterm, being less than 37 weeks gestation, term, which is 37 to 41 weeks, and postterm, being 42 weeks and over. It is said that around 90% of babies are born at term in Australia. Milestones within child development are essential for assessing a child's performance in coordination to the age appropriate comparison, providing important information about their development. Knowing when a child starts to play, speak, crawl, or walk gives us an indication about any signs or signals that may lead to future complications. With relevance to podiatry, the Gallup milestone indicators provide us with a guide to assess whether a child's ability to perform gait or motor tasks are appropriate to their age. At 6 to 8 months, a child typically begins to sit with support, and it becomes a concern if they are not sitting independently by 9 months. From 6 to 12 months, most infants start to creep, crawl, scoot, or roll to move around. By 9 months, they can usually stand while holding onto objects for balance. Around 12 months, many children begin to walk with assistance or along furniture and may even begin to take a few unsupported steps. It is considered a concern if independent walking has not been developed by 18 months. At 15 months, most children walk well without support, often with a wide base gait for stability, and by 18 months, they can run unaided still with a broad base gait. Finally, at 2.5 years, they can jump with both feet and may begin to walk on tippy toes. However, if a child is unable to jump by school age, it may indicate a developmental concern. It is essential for podiatrists to know developmental milestones because they can provide a framework for assessing whether a child's lower limb growth, muscle strength, joint alignment, and gait patterns are progressing normally. Understanding when a child should sit, crawl, stand, walk, or run helps podiatrists identify delays or abnormalities that may indicate underlying musculoskeletal, neurological, or developmental issues. Early recognition of deviations allow for timely intervention and referral, preventing potential long-term gait or postural problems.
As a parent, it's natural to wonder if your child's walking and foot development is on track. Most kids develop their own unique walking style, but sometimes little differences can be early signs of something more. In this short guide, I'll walk you through what to look for, what's normal, and when it might be time to check in with a professional. Let's start with how your child walks, or what we call their gait. Most children begin walking between 12 and 18 months. At first, it's wobbly with wide feet and arms out for balance. That's completely normal. But here are some red flags to watch for. Not walking by 18 months, walking on tiptoes all the time after age 2, limping, dragging one leg or walking unevenly, falling a lot more than other kids their age. Some children walk with their feet turned inward. This is called in-toeing, and it can be caused by a few things. Metatarsus adductus, where the front of the foot curves inwards, internal tibial torsion, where the shin bone is twisted inward, or femoral anteversion, where the thigh bone turns in, making both knees and feet point inward. Most of the time, these are normal variations that improve with time, but if it's severe or not improving by age 7 or 8, it's worth getting checked. Now let's look at how your child's legs and feet appear when they're standing or walking. Some things to look out for include feet that turn in or out a lot, legs that seem bowed or knock-kneed, especially after age 5, one foot or leg that looks different from the other, or feet that look very flat or stiff when walking. Children with conditions like knock-knees often have knees that angle inward, causing the lower legs and feet to point outward. Contrast with bow legs, the knees stay wide apart while the lower legs and feet turn inward. Pain is not normal in young children who are still learning to walk. It's important to talk to your child and watch out for the following signs listed below. Now, in terms of developmental milestones, here's what to look for. Not crawling by 12 months, not standing by 16 months, or not walking by 18 months are all serious red flags. Delays can be due to muscle tone issues, coordination problems, or more serious neurological concerns. If something doesn't seem right to you and you want peace of mind, reach out to a health professional. Thank you.
Now, let's have a look at when parents should take their kids to see a doctor for flat feet. In general, there are three things to consider: how the feet move, symptoms, and age. The first factor is to see if the flat feet are flexible or rigid. Flexible flat foot means the arch is reduced or absent when your children are standing, but it returns if their feet don't carry weight when they sit or lie down. Rigid flat foot means the arch stays flat even when there's no weight on the feet. Flexible flat foot is usually a normal part of development, but rigid flat feet at any age can suggest an underlying issue, such as tarsal coalition, and should be checked by a doctor. The second factor is symptoms. Pain is a key symptom. If you find your kids have activity-related pain or midfoot pain, you should take them to a doctor. Other symptoms may include muscle fatigue and functional limitation. The last one is age. Flat feet are quite common in babies and young children. This condition will be improving as they grow up, and only 4% of children have flat feet by the age of 10. Here is a quick guide for parents. When you think your kids need medical intervention, you can check their feet to see if they are rigid or flexible. If they are rigid, go to see a doctor. If they are not, the next step is to consider if your kids complain about pain or other discomfort in their feet. If the answer is yes, go to see a doctor. If not, or we should consider age. For children under 6, flat feet are usually not an issue. For children between 7 and 10, flat feet can be a problem if they cause any symptoms, especially pain. Finally, if your kids are over 10, this condition might be normal, but it's recommended to see a doctor for assurance.
Management. In regards to the management element of flat feet in younger children, the option to treat or not treat simply comes down to if the child is symptomatic or asymptomatic. This approach is typically taken by health practitioners as a flat arch is typical for children at birth, but it tends to resolve spontaneously until 6 years of age. A common management method for flat feet is strengthening and stretching exercises. This is a viable option as quite often the underlying cause of pain in children in flat feet is due to tight muscles or tendons. For instance, it is quite common that a tight Achilles tendon is the cause of discomfort, as since the Achilles tendon connects to the calf muscles to the calcaneus, when it is tight, it restricts the movement of dorsiflexion of the foot. And to compensate for that limited dorsiflexion, quite often it causes your feet to slide inwards, causing overpronation. And it's this overpronation movement that can cause the arch to collapse. To overcome this Achilles tightness, practitioners will quite often recommend a stretching exercise called the heel core stretch. It involves your child standing and facing the wall with one leg in front of the other. The back leg must remain straight with the heel down and the front leg's knees are bent. They hold this position for 15 to 30 seconds and is performed 3 times daily on each leg. The purpose of this stretch is it stretches the Achilles tendon and calf muscles, which can assist in preventing the foot from rolling inwards, which can help in relieving stress off the medial longitudinal arch and prevent it from collapsing. The benefit of completing stretching and strengthening exercises in young age children with symptomatic flat feet cannot be underestimated, as delaying intervention until late childhood might increase the risk of persistent deformity. Another option in the management of flat feet is the use of orthoses. While they are less commonly used in children under the age of 5 due to ongoing foot development, they remain a viable option in certain cases. A key limitation is that young children outgrow orthoses quickly, making frequent replacements necessary, which can become quite costly for parents. Despite this, the benefits are significant. Orthoses provide key structural support to the medial longitudinal arch, promote proper foot alignment, and reduce excessive pronation. This helps distribute pressure evenly across the foot, reducing pain and stress on key structures such as the posterior tibial tendon, the primary support of the medial longitudinal arch, and is quite commonly strained in flat-footed individuals. However, orthoses should be considered a supportive short-term intervention rather than a permanent fix, used primarily for symptom relief when conservative methods are insufficient.
Footwear advice for children. Children are continually growing, so their shoes should be comfortable, stable, and allow natural movements. For toddlers and babies, it is beneficial for them to spend time walking barefoot. This helps them strengthen foot muscles and helps with coordination and balance. When children begin walking outdoors, the shoe should have a flat sole, and according to Dr. Saul Williams, he describes that the shoe should have a moderately flexible sole too. Children's feet are growing all the time, so checking the toe box is very important, as blisters and even gait development issues can arise. Parents need to know that every child does not walk the same. Some kids may walk in the toes predominantly or be unsteady while walking. It is important to know that children's walking patterns will improve over time. Thank you for listening to our presentation.
Like homogenous little lines throughout there, where these anechoic areas are different.